Hello, this is John Armwood on the Armwood Opinion Channel, and today we're going to talk about Medicare for All. It's a proposal that has been put forward by a number of people in Congress, both on the House side, the House of Representatives, and the Senate. It actually, the bill was written by Bernie Sanders, Senator of Vermont and presidential candidate. And a number of people have embraced it, most notably Elizabeth Warren in the Senate and the squad, led by Alexandra Ocasio, Ilhan Omar, Representative Presley. That group of Congress people have endorsed it. And basically what it is giving everyone in America, a similar health plan that senior citizens like myself have. And it actually goes beyond what we have. We have basically a government administered private insurance program where each senior citizen pays approximately around $135 a month into a system that we've been paying into throughout our working lives. You know, you see out of your check money coming out every month toward Medicare. Well, that accumulated monies along with your monthly premium keeps this happening. So that's, what is important. And so with Medicare for All, we're talking about those people who are under 62, and it would coming in stages. The first stage, according to the bill that was written by Bernie Sanders, it would start with those who are 55 and older, and then later 45 and older, and go all the way down to everyone would be covered by it. And understand, every single country in the developed world has health care like this. It's only the United States. You ask, why are we so far behind? Because of the lobby of the insurance industry. They want, and the pharmaceutical industry. Congress, a number of years ago, passed a bill that wouldn't even allow the government to negotiate in a free market for the best prices on prescriptions. That's insane. Of course, Bernie Sanders' Medicare bill proposes to do away with that restriction. That is giving the drug companies an oligopoly. They are a group of people who can set prices high, and there's no real competition for the prices because the Medicare administration cannot lobby as a group. As a group, they would carry a tremendous amount of weight. But no, the industry doesn't want it. They give donations to political candidates, and as a result, they voted to not allow the free market system to work. This causes prescription drugs to be much more expensive in the United States than they are in other places. That's why in the border states along the border with Canada, Americans go across the border to buy their same prescriptions at a cheaper rate. This is ridiculous that we would pay more for drugs largely made in the United States across the border in another country because Congress doesn't allow the government to negotiate. The insurance companies make a fortune off of insurance, which makes it harder for individuals as well as corporations who have to pay insurance for their employees. If we had a single payer system, the government which administered health care, when you changed jobs, you wouldn't have to worry about losing your health care. The big issue that people raise with this is, would it raise taxes? It might raise taxes slightly on the very wealthy. The person making under $200,000 would not see any increase whatsoever. In fact, their costs would decrease dramatically under a universal single-payer Medicare for All system. This is really the only rational way to do it. Republican propaganda, led by Mitch McConnell, I like to call him Moscow Mitch, and his crew, Lindsey Graham, and that group of thugs, only care about the wealthy corporations who feed donations into their pockets. They are corrupt. We are paying as a result of it. They tried to get rid of the Affordable Care Act. The Affordable Care Act helped to save my life. I was working, I was a college professor. I developed prostate cancer. While I was on temporary disability, the college I was teaching at went out of business. What does that mean? There's no COBRA. There's no insurance that I could carry on and pay for myself. I would have been uninsurable because I had a pre-existing condition and I needed surgery within a month of when the school went out of business. I wouldn't have not been able to get any insurance but for the Affordable Care Act. More people go bankrupt in the United States because of healthcare costs than any other reason. We are the only major industrialized country in the world that allows this type of craziness to go on. We have universal education for children in elementary school, middle school, and high school. Everybody accepts that. We have universal protection for fire and police service. Everybody accepts that. Why do we not have it for health care? It's also a service that everybody needs. You can die if you don't have it. People don't buy their medications because of the affordability. They miss doctor's appointments because it is expensive, those copays. Under Bernie Sanders' plan, those copays would disappear. When you get real sick, you need to have a lot of doctor's appointments. I've canceled appointments because I couldn't afford to go, because those copays add up. So this is something that we have to address at some point in America. We have to do this. This is not rocket science. This is common sense. I have lived in a country that had a single-payer universal health care system like Medicare for All. The Republic of Korea, which people call South Korea. There's really no such country as South Korea. It's really the Republic of Korea, as opposed to the DPRK, the Democratic People's Republic of Korea, which is the northern in the on the Korean Peninsula. They had it. I got sick under that system. It was so much cheaper. I had my doctor's cell phone number. I could call my doctor anytime. And I had to do it a couple of times because I got very ill. I come back to the United States to an inferior healthcare system. It's something to think about. Most Americans do not travel. Most Americans do not realize that our healthcare system is not world class. If you have a lot of money and you can afford to go to very wealthy facilities, you will get first class healthcare. But if you're a typical middle class American, it's not going to happen. Your healthcare will not be first class. That is unfortunate, but that is the reality. Medicare for All is an attainable solution. Get over the fear. All right. Hit the like button if you like this video. Subscribe to my channel for more videos like this. And remember, resistance is not futile. All right now. Have a good day, and I'll see you in the next video.